A clinical neurological assessment called the Babinski sign is the upward movement of the great toe and associated with a fairly isolated reflex of the extensor hallucis longus and slight contraction of other flexor muscles in the leg. The normal plantar response to cutaneous stimuli of the sole can be considered a superficial reflex that are abolished by an upper motor neuron lesion. It is then replaced by the Babinski response. The upgoing toe is regarded anatomically as extension of the great toe, but physiologically it is part of a flexor reflex. Apparently disinhibited by loss of upper motor neuron control, its receptive field may extend in some instances to the leg or thigh. This led to the description of many reflexes, such as Shattuck's and Oppenheim's signs, which were simply different ways of eliciting the Babinski sign. Foot drop is a deceptively simple name for a potentially complex problem. It can be defined as a significant weakness of ankle and toe dorsiflexion. The foot and ankle dorsiflexors include the tibialis anterior, the extensor hallucis longus, and the extensor digitorum longus. These muscles help the body clear the foot during swing phase and control plantar flexion of the foot on heel strike. Foot drop can be associated with a variety of conditions, including dorsiflexor injuries, peripheral nerve injuries, stroke, drug toxicities, or diabetes. Clawing of the toes in the diabetic neuropathic foot is believed to be caused by muscle imbalance resulting from intrinsic muscle atrophy. This is associated with a distal displacement of the protective submetatarsal head fat pads and an increase of plantar foot pressures at these regions. Furthermore, claw-toe deformity has been found to be a predictor of diabetic foot ulceration, a condition that may lead to infection or amputation. Therefore, proper understanding of etiology is important if we are to initiate or improve interventions for the prevention or correction of claw-toe deformity. There are several etiological theories that may explain why claw toes develop in diabetic patients. Ill-fitting footwear externally forcing the toes in a clawed position, the plantar fascia or ligament contractures at the metatarsal phalangeal joints, or the most commonly reported cause of claw-toe deformity is intrinsic muscle atrophy and weakness due to motor neuropathy, leading to an imbalance between intrinsic and extrinsic muscles across the metatarsal phalangeal and interphalangeal joints. When the intrinsic muscles are atrophic and overpowered by the extrinsic muscles, the stabilizing action is lost, which eventually may result in clawing of the toes.